One of the exciting things happening at the moment is the convergence of technologies across drugs, devices, diagnostics and data. I was recently at the AdvaMed conference in the US, banging the drum for UK life science sector, and what really struck me is there's no such thing anymore as digital health and non-digital health. It's all becoming digital, and we're seeing an extraordinary convergence with companion diagnostics coming alongside with therapeutics, with new business models being developed through and being demanded by new technologies. The self-monitoring pharmaceuticals, technologies like Proteus, some of the new smart diagnostics, the remote tele sensing devices. This is changing the way healthcare is going to be delivered, and it's changing the business model of healthcare as well, and that's a very exciting and very challenging transformation. I think the UK and the NHS are ahead of the game in some areas, and I think we're behind the curve in others. I think we're ahead in terms of our deep research. I think we're ahead in terms of being the first country in the world. This spring we'll have reached full digitalisation of primary health care. We're going to be mandating here at Department of Health that all electronic health records are made available to patients free of charge, on demand. We're ahead of the curve on genomics. We're ahead of the curve on our £1 billion a year NIHR research infrastructure in the NHS. Where I think we've got more to do is on getting quicker access to patients, quicker uptake of innovation into the system, and that's really the focus of my job here as Minister. The digitalisation of healthcare, I think, is hugely exciting, not just because it will allow us to adapt care pathways, involve patients in fewer journeys to the GP, fewer car parking, traffic jams, old-fashioned healthcare by queue. It'll liberate patients to get the healthcare when they need it, where they need it. I was looking at an app the other day that allows you to place a prescription through your GP and then pick it up at a pharmacy that happens to be convenient for you, near you, while you're at work, wherever you are. But it's also that technology, I think, will change the way people think about healthcare, and I think it's all to the good. We need to move from a 20th century model of healthcare, something people think of as something done to us by government when it thinks we need it, to healthcare being something that all of us as 21st century citizens take more responsibility for. Well, I hugely welcome the Astellas Innovation Debate, and this year's theme particularly looking at the power of DNA and data, the two transformational technologies that are changing the landscape for life sciences in the 21st century.